Following the release of the first Census 2021 results, we're now publishing more detail through a series of topic summaries. The Census 2021 Health, Disability and Unpaid Care topic summaries tell us more about the number of people in good and bad health, the provision of unpaid care, and the disabled population in England and Wales.
For most of the data that we've released so far, it's raw proportions in the population, and for health, disability and unpaid care, we've age standardised the data. And the reason for this is it enables us to compare between different geographies and to compare over time.
As in 2011, Census 2021 included a question on general health. Using a self-assessment of health can be a useful indicator of the population's general health-related quality of life.
So the health data that we collect is really valuable to a wide range of users, including local authorities, charities, all the way down to the citizen users, just for interest. It's really valuable for planning things like state pension age review and feeding into healthy life expectancy and understanding the health of the population as a whole, but also with small local authorities, so that different areas can understand how they're doing in comparison to other areas.
We collected Census 2021 data during the coronavirus pandemic, so you might find it strange that it shows an increase in the number of people reporting good health across England and Wales. This could be because the coronavirus pandemic influenced how people perceived and rated their health. We've planned further analysis to census data that will allow us to understand general health better. We can also see the variation in general health across local authorities. For example, Tower Hamlets, Blaenau Gwent and Merthyr Tydfil had the highest proportions of people reporting bad health. This kind of information helps to plan and allocate local resources and public health spending.
This time we've changed the disability question from 2011, so we included mental health as a reference this time, and we removed including problems if they're related to older ages. We measure disability in line with the Equality Act, the definition of disability that's given in that. So it enables us to understand how many people are disabled and what proportion of people are disabled within different areas across local authorities and across England and Wales. And that's really useful for planning health services, and it's useful for understanding how we're doing against equality for disabled people as well.
The results showed a decrease in the proportion of people across England and Wales we identified as disabled, down from 19.5% in 2011 to 17.8% in 2021. They also showed the differences in the disabled population across regions and local authorities, where Blackpool, Blaenau Gwent and Neath Port Talbot had the highest proportion of disabled people in England and Wales.
An unpaid carer is anyone aged 5 years and over who looks after or gives help or support to someone who has a long-term physical or mental health condition, an illness or problem related to old age. We're seeing that there's an increase in the proportion of people providing 20 hours or more of unpaid care. And it's really interesting because Census was obviously taken at a really unique time point during a pandemic. So there's a lot of nuance there around what was happening in society at the time. So there were rules around household mixing, which could be impacting the number of people who could be providing and visiting relatives potentially within their homes. So therefore, where care was potentially split between siblings before for an elderly parent, that care could therefore have been provided by one individual.
We'll be publishing further detail on the topic of health, disability and unpaid care in future releases. This will add more detail to the picture and help us understand those high-level trends across communities.
Census 2021. Learning about your community has never been easier.